Hello everyone, this is Dr. Sue from Purely Pediatrics. This week I would like to talk about poison ivy. And although I mentioned that poison ivy is the discussion, this includes poison oak, poison sumac, as well as poison ivy. So poison ivy is something that is generally something we notice that is in the warmer months, such as the spring and the summer. Poison ivy is something that can be very, very stubborn and can cause a lot of distress among families, particularly parents that are trying to help children with the symptoms of the rash. And I just want to talk a little bit about the poison ivy rash. The poison ivy rash can actually look like a reddened area that can have some blistering. The blisters can be very tiny. They can travel in a line only because that's kind of how that plant can actually touch us, where we kind of rub against that plant. It can occur anywhere in the body that has been exposed to the plant, the poison oak, poison ivy, or poison sumac. What happens is the plant does have a substance called urushiol, which is a toxin and causes the rash to occur on our skin. Now, this is something that it can be washed away, which can make things much easier. So if we are exposed to poison ivy, and we know that we are exposed, we do want to make sure to wash ourselves quickly as possible with soap and water to get that urushiol totally off of our skin. If we're unable to do so, please feel free to make do. You can use water, just putting a water bottle over the places that might have been exposed. Oftentimes, unfortunately, we don't know that we were exposed. We can be hiking and there can be multiple different kinds of plant varieties available that we just aren't always aware that that's happening at the time. So unfortunately, it's not always possible to get that urushiol off of our skin. Now, urushiol, once it does cause a reaction, it's more of an irritant reaction on our skin. What happens is we can get a red rash, a little blistering rash that can actually itch quite terribly. It can be very frustrating, and unfortunately, if that urushiol is still on our skin and we are starting to scratch the rash that can occur generally within 24 to 48 hours, then we can spread that rash, not only amongst ourselves, but to others as well. So really washing off that urushiol really prevents the spread, not only amongst ourselves, but to other people as well. So the rash is something we want to try hard not to scratch. Benadryl is a wonderful antihistamine that can try to help that scratching, but because it's not a true allergic reaction, the antihistamine may not work as well as we'd like it to. If the areas are quite small and they're able to be treated with a topical hydrocortisone that you can get right over the counter, can be a wonderful way to help to manage that itch so we don't scratch, don't spread it, and let it heal on its own. So topical kinds of steroids that you can buy over the counter, which are generally quite gentle, can be very, very helpful. If, unfortunately, we are exposed to a large part of our body to the poison oak, poison ivy, or poison sumac, then oftentimes it's something that needs to be treated by the pediatrician or the family medicine doctor. There are some times that I have had to order oral steroids for a couple of days just because the rash and the discomfort were so widespread, and we needed to try to help that patient to feel better so they stop scratching and allow those areas to heal. I would love for you to take a look and even to Google poison ivy, poison oak, and poison sumac with your children so you can all understand what it looks like and do your best to prevent it. One thing that can happen too that we don't always think about is if these plants are actually burned, if they're part of a campfire, then that urushiol can actually be present within our nasal passages and our airways and can cause discomfort as well. So we want to make sure when we set up campfires and camping, when we do have some camping activities that we involve some campfires, please make sure that you are aware of what these plants look like. Try to tell your children not to put green plants into fires, only because they just don't know what those plants are. And that's something that can be very uncomfortable. And that would, again, require some medical care to help to deal with that. So in general, prevention is key. Knowing what these plants look like, trying to avoid them as best as possible. If you are exposed, trying to wash those areas of your skin as best as possible quickly within 30 minutes is key. And getting that urushiol off of your skin is going to be critical. If, unfortunately, you don't know that you were exposed, or it's something that you just can't seem to figure out a way to get that off of your skin right away, just know it's never too late to shower it off. And make sure that you know that you can manage the discomfort with ibuprofen, with Benadryl, and with topical steroids that you can get right over the counter. All right, I think that's it for now, you guys. I hope this is helpful. And also wearing longer sleeves when you're hiking, if you can, such as longer sleeves up top and on the bottom, it may be really helpful to prevent that urushiol from touching your skin in the first place. Remember, though, that it can get on the clothing, so when you're taking your clothing off, remind your children and yourselves that you want to make sure to have as little contact with those clothes as possible on the outside of them, so you can prevent any rash from occurring at that point. All right, you guys, here's to a wonderful summer. Thank you.